Thanks very much, Anne-Marie. My name is Lynn Grayson and I'm a speech and language therapist within the Lanarkshire Community Brain Injury team. And when I was asked to do this talk, which was titled Community Support for the Person Following Brain Injury and Their Family, I thought the best way to maybe show this was to ask one of my patients and their carers to speak to us about their personal experience of what it feels like to be discharged home into the community at different stages along the way. My email is just on the slide there, so if anybody wants to contact me, please do. Just to say a little bit about the Lanarkshire Community Brain Injury team, we are a group of physiotherapists, occupational therapists, speech and language therapists, psychologists and rehab assistants who will see the person following brain injury and their family in their own home for rehabilitation. We make lots of links with other services and do lots of signposting to Headway and family carer support services and lots of other services. But I thought it'd be best for the person to explain themselves what it feels like and what support would be useful and would be helpful. Can you change the slide? Thank you. So the aim of the talk is to gain first-hand experience of what it feels like to be discharged home from hospital after a severe brain injury from the perspective of the person following brain injury and also the family member. We wanted really to find out how the person following brain injury and their family member feel at 3 different time points following discharge home. So what does it feel like straight after discharge home? What does it feel like after 3 months following discharge? And then what is it feeling like after 6 months following discharge home? Next slide, please. So the questions I wanted to ask was what is going well and what issues are you experiencing at the moment? What support would be helpful in the community at this time? And any hints and tips for other people that are in a similar situation, what would you advise? Next slide, please. So just to introduce Craig. Craig had a sudden bleed in the brain in October 2021. He required burr-hole surgery and several brain scans to monitor his condition following that. No cause was found for his bleed in the brain, and Craig was discharged home after a 4-week hospital stay. Craig lives with his partner, Kerry Ann, and Craig was referred to the Community Brain Injury team in Lanarkshire for rehabilitation just after he was discharged from speech and language therapy, physiotherapy, occupational therapy, and psychology. This rehabilitation was carried out using a combination of video calls and some face-to-face appointments once the COVID-19 restrictions were relaxed. And when you watch the video, you will see the impact that COVID has had on the ability to receive support in the community. Next slide, please. So here's the video. Thank you.
Sorry. That's us recording now, so thank you so much for joining me and for agreeing to do this for me. I'd just like to introduce Craig and his partner Kerry Ann, and they are very kindly going to just give us some feedback about how they experienced being discharged from hospital after a brain injury. Perhaps it might be quite good just to start by asking what type of brain injury you had actually. Would that be okay to say something about that?
That's fine. Yes, that's fine. Craig had taken a subacroid hemorrhage and it all happened out the blue. You know, there was no signs, there was no warnings, and extremely unfortunate.
Great stuff. So when you were discharged from hospital at first, how did that feel for you both? Was there anything good about being discharged home? What did you feel was going well right at that time?
Well, the good points, I suppose, were the fact he was getting home. That was the biggest thing, because it had been an extra tough time due to the COVID situation and not being able to visit the hospital and not being able to see anyone face to face and sort of hanging on to every word you were being told over the phone. But it came with a whole range of emotions, as in for myself personally as his partner and, you know, due to be sort of carer, if you like, you know, I was extremely apprehensive, frightened, worried. It was a real roller coaster of emotions, shall we say. And I'm sure it was maybe the same for Craig, but there would be a lot of different things there for you, wouldn't there? What do you think? How did you feel?
Well, I was trying to understand what had happened to me. That was a difficult thing, trying to understand. And then as the weeks progressed, then I was learning actually what had actually happened to me, because Kerry Ann, my partner, was filling me in regarding that, because regarding hospital, I didn't realise I was in hospital for 3.5 weeks. It was only possibly maybe two to 3 days before I was discharged that I realised I'd been in hospital for that length of time. So,
and when you were first home, Craig, what were the things that were affecting you most? What were the biggest issues for you?
Well, my worries, my issues regarding was this going to, I didn't understand what had actually happened to me regarding that. My main worry was if this was going to happen again, because no warning signs leading up to it. I was trying to track back, did I have any sore heads or a knock in the head and things like that? And as I said, no warning signs. The big worry was, can this happen again? And until I was referred to the brain injury team and speaking to you kind of reassured me and answered a lot of kind of questions regarding that, put my mind at rest a bit, you know.
Great stuff. And did it affect your sleep at all or anything else?
Oh yeah. The first couple of weeks when I get out of hospital, obviously I was on strong painkillers and things like that, and on seizure medication. But as I said, my sleep was terrible. I had horrible nightmares and things like that, and tossing and turning. Yes, that was a difficult period. The first couple of weeks getting out of hospital, sleep was very bad. Yeah.
And thinking back to that time, is there any sort of hints and tips for us working in services, maybe in the hospital or community services? What information and support would have been good, maybe before you were discharged or after discharge?
I think it's, you know, they were so good in the hospital, Lynn. They were fantastic given the circumstances. So you don't really want to be down on it, but I think, you know, there was just this added huge pressure because of the COVID, and you couldn't see anyone, as I already said, face to face. For me personally, that would have been one of the biggest things, you know, to be able to see, because as we've had a conversation about many times, when Craig left the hospital, when he was discharged that day, I turned up to pick him up and there he was, just stood at the door with his bag, and I was like, oh my goodness, like, here we go sort of thing. And that was it. And he was just left out to me with a bag of medication. That was tough and frightening, I have to say, you know. And I remember it at one point as well thinking, wow, you know, because he still obviously didn't look very well. And I remember actually having the thought of, should he be coming home? You know, and I was going with their word, obviously, and desperately wanted him home. But when I saw him, that was a shock also. And I kind of thought, wow, should he be coming home? Is this the right thing? And there was no one to have that conversation with, sort of thing. It obviously had been discussed previously over the phone and, you know, many times, but when you actually see that person you care about, you know, that's something else. You guys, you know, for me, the next big thing was just for you guys to step in and be that support network. That was just huge. You know, that was really huge.
And how about kind of referral to onward services or follow-up appointments? How did you feel? Did you feel that was all fine before you left, or?
Not really fine. What I would say is probably they're not very forthcoming with any of this information. Unfortunately, I've kind of been in this position before, so I was able to know about yourselves and understand how that part of it works. But it was certainly myself that had to ask for that and ask for, you know, you guys to intervene, sort of thing. So I had to request that. But if you didn't know, then no, for sure, no one was really saying to you, this is what's available in the community and this is what's available to you at home.
Maybe that's a big message for us, so that we need to get our services out there a bit more so that people know where we are. Thank you, that's been really helpful. How about moving on, maybe 3 months time to when you've been home for 3 months now, Craig? Where had things progressed? What things did you feel had progressed, and what issues were you still having at that time? So that's around about January time.
Well, I was learning a lot from my partner, and also you were obviously learning me how to deal with my anxiety levels were very high at that time after the kind of 3 months, and obviously getting the proper tools and breathing exercises and maybe getting up and trying to think about other things regarding that. My anxiety was very high at that time and things, and we felt with the brain injury team that it gave us the tools to kind of deal with these situations, which was very helpful. So
yeah, it was. You know, with you guys, it's just been amazing, Lynn. You know, really, it would have just been so tough to manage without the support of your guys. You know, there's in every way, there's not even one specific thing. It's a whole combination of things together.
Mm-hmm. And did you have any other issues at all, Craig? How about your memory? Had that progressed at all, or communication difficulties, or physical skills? Where were you at about 3 months after injury?
My physical side was more progressed than my cognitive side. That was behind, and that was kind of frustrating because to kind of catch up with my physical side, because I was saying, oh yeah.
Well, your memory was, that was one thing that you were struggling with. It was that your cognitive part was poor, and you did have to work really, really hard on that.
Yes, well, I'm still kind of slightly struggling a wee bit. I'm still basically in kind of rehab as such, recovery. Mm-hmm. But as I said, my physical side was more advanced than my cognitive side, and then try to understand that eventually that will come. Mm-hmm. With my physical side of it, it's just to be patient. They say slow and steady wins the race, but when you're a kind of very active kind of guy before my injury, you need to be patient and things will come. Mm-hmm. It'll catch up.
And way back at the beginning, did you think it would take as long as it has taken, or were you surprised at how long it's taken? Or
I'm very surprised, and as I said, this is me 7 months down the line, and I'm still basically recovering. It's been a lot of learning, basically, for me, understanding how severe the injury was to me. You know what I mean? I didn't think that talking to people would be tiring. I thought the reason why you get tired was when you've done physical exercise. But now I realise that actually speaking to people, and maybe even on this Zoom call to yourself, Lynn, it's very tiring. Mm-hmm. Maybe later on this will catch up with me. Mm-hmm. As in talking to, you know, it's just a learning curve, a big learning curve for me.
I think you've put that really, really well. Do you think that your fatigue and your tiredness had improved from when you were first discharged to when 3 months later, or do you think it's only now that you're beginning to see some progress with your tiredness, or do you think it's still the same?
No, it's definitely improved. I can maybe get by 7:30 without a yawn now. Mm-hmm. No, my fatigue, and as I said, but the physical side's really improved quite a bit, but the cognitive side's behind. But hopefully I'm working towards getting that a lot better now.
Great, thank you for that. And what about you, Kerry-Ann? What issues were you having as a partner in January? What things were difficult for you then? And
only to give nice answers, Lynn.
no, this, no holds barred.
I know. No, it was a real struggle, to be perfectly honest, just, making no bones about it, because it's, Craig's there explained to you, he couldn't even understand still what was happening to him really, and what had happened to him. So first of all, trying to deal with that, and then trying to deal with an extremely independent guy, that works 6 days a week, going to this person who really couldn't do much at all for himself, and was needing basically 24 hours care, down to, just from waking in the morning to going to bed at night, making sure, he was getting up okay, how he was feeling, making his food, medication, everything, just everything. So yes, very difficult. So the independence part was huge as well for him. The moods is another massive factor, that you have a good day, you have a bad day, or you have 5 bad days and 2 good days. There's no rhyme or reason to any of it. You just sort of need to ride the storm, shall we say, because that is how it is. And you just would never know how he was going to be. But then it could be as well that he would be like that, and it may last for such a short time, and then he would just, it was like a light switch goes off, and then it was just back to Craig again. Sort of thing. So those things I found, very, very tough. And it's still tough. It is still tough. But again, through the help of yourselves and going forward, you're giving Craig a lot of tools to work with that, and to myself also, which gives us both the tools to use to try and deal with this together. And it's very, very important to try and work together, because so easily you could go against each other and it just would not be good. But I think that's, have patience. You need patience and understanding. And especially, again, if it's from, a very active person, a normally very healthy person, then it's a big turnaround. I mean, our lives literally flipped, in the blink of an eye.
And do you think it would be good for families and carers to get some support as well? Do you think that's needed?
Yes, I definitely do think it's needed. I mean, as much as it's all about the patient, I really do not think you can underestimate the carers, needs as well in this. And I think with I know there's a lot of people throughout the country look after people day in, day out, and they care for them. But a brain injury, for me, is a bit exceptional, because it's the thing you can't see. People are coming out the hospital with this major trauma having happened to them. It's not, not to demean anything, but we haven't broken an arm or broken a leg here, that we'll patch up in a few weeks' time. It's something that's there and probably going to be there for the rest of your life now. And it will impact you in some shape or form. And it's about learning to readjust, and us readjusting our lives to live with that now, because our lives have changed, because of it, and they will have change going forward. So for the carer's point of view, yes, you definitely do need support, and it would be really, really good to have, maybe, and again, I would talk about the tools. I think it would be really good for carers to have tools to try to deal with this and understand and work alongside their partners and help them get through it. As I mentioned before, unfortunately, I have, some experience of this, so I did have prior knowledge, but for someone that doesn't have prior knowledge to this, it's going to be really tough and really, really difficult, because, as I say, you can't see this injury, and that's the bit that's very, very hard. And even for the outside world to see, you're living with it day in, day out, but nobody else sees that, and they don't get it, they don't understand it.
So it's the hidden disability. So it's just as important for for services to think about family and carers as well, and to get carer support services involved.
Yeah.
It was just so difficult with COVID, wasn't it? That there was it's really difficult to find support services, wasn't there? During this time. But hopefully, we're coming out of that now. So we're just going to move forward to kind of present day, when 6-7 months following discharge. So what's going well for you now, Craig, and what issues are you still having, and what are you looking forward to, looking to the future?
Well, next week on Tuesday, I'm going back to work on a phased return for 8 to 10 weeks, which I'm looking forward to doing, getting back to hopefully a bit of normality. But I'm still feeling a bit anxious regarding it. Mm-hmm. It's another step towards my recovery, basically. But by all means, I'm looking forward to it. And with the support I've had from you, has been fantastic in trying to understand my injury, basically. I didn't realise how severe my injury was, but now I've got a bigger understanding regarding it now, you know what I mean? And it's been very helpful.
You were also saying to me as well that driving, not being able to drive, is a big issue, isn't it, when you're so used to being able to just jump in the car?
Yeah, it's a bit, your independence has been taken away from me as regarding that, and because as I said, I was an independent guy, done things for myself and things, and I don't like really relying on people and things like that. That's been very tough. Mm-hmm. The driving side and having to rely on people, having to do things for me when I was a guy done having for yourself, basically, you know what I mean? So it's been tough that way, you know.
And would you say that in terms of your cognitive and thinking skill side of things, would you say that that's completely back to normal, or are you still needing to use strategies to help you do things?
Still needing to use strategies. I need to concentrate more when I'm speaking to people, so that hopefully I don't say the wrong word and things like that. And it's harder to speak to people because, as I said, you need to concentrate, and that's very tiring. I didn't realise that speaking to somebody, I'm repeating myself here, if I can remember that part, as in where it's very tiring as such, you know what I mean? I thought it was just physical, and doing anything physical would tire you, but actually speaking to somebody, now I realise that's a tiring aspect.
I know, absolutely. And what about memory? Are you needing to use strategies to help your memory, or?
Yeah, I've been advised to use a diary and things like that.
I've been going on about it a bit,
yeah. It's something that I've never ever used before. But to be fair, at my work, I started using my diary at work when I was getting deliveries in and things like that. So I'm a wee bit advanced at my work with using a diary, not so much maybe in the house as such, but that's one strategy I think that I'll be going forward that I'll use. So, yeah.
Good stuff. And just one final question, that, at 6-7 months post-injury, do you think you guys still need support, or do you think you're ready to not have support? What do you think? Do you think that even though it's 6 months since your injury, do you think you still need support services?
Well, that was something I had actually just noted down, Lynn, because I had actually wrote, it really needs to be, again, my point of view, but it would really be good if it's a gradual process, and it's not just 6 months. Okay, you're a bit better, you're doing well, you're using your strategies, you're managing, you're going back to work for a phased return, there you go, bye-bye. I still think it needs to be a very gradual process, because I don't think that would work out. I think then both of us would feel, oh my goodness, that's it, they've gone.
High and dry,
Yeah, they've gone. And it's still very, very early days into this sort of injury. So I did actually, think about that when I was reading through the sort of questions that you'd given us. And I also think it would be really helpful, for you to kind of stay with patients, because it's a massive thing for them going back out into the big world, if you like. So I still think that there probably could be a lot more support there afterwards to get them back to normal life. So not just about the injury now, and not just about dealing with the injury, but trying to sort of integrate back into normal life. That, you know, I think that would be a massive help for them. That side of it, from my point of view, well, I still go to work. Nothing like that's changed for me, and probably that would be the case for the carer. But for the person that's had the injury, I do think they need, you know, a lot more support trying to get themselves back out there. Yeah.
I think that's a really good point, and quite an important point for services to take on board, because I think often, particularly within NHS, it can be quite time limited, can't it? And that can cause quite a lot of anxiety for family members. I think it's also about signposting you into other services now that COVID hopefully is doing one. We can, you know, think about other support services that are all starting back up again, and we can signpost you into those things. Is there anything else that you'd like to say that I've not covered, or do you think?
No, I think one thing I was going to probably mention for yourself, Lynn, was just about the communication. I just think it's so important to keep the communication going with, you know, yourself, your partner, the hospital, all of that. Just keep it going, because we did have a few tricky times where there was appointments missed, you know, and if it hadn't been for myself on the phone, chasing it up, you know, things might not have just gone the way they did. So you just have to sort of hang in there and be a bit headstrong at times, and you have to kind of stand your ground with some things, and just, you know, it will come, but you do need to be a bit like that just to get it done. And make sure that you keep that communication going at all times.
And did you feel that you had to be an advocate for Craig, really, that actually if you weren't phoning the hospital to think about follow-up appointments, that they, you know, you would be in a bit in the dark and you wouldn't?
Yes, 100%. I think numerous times I've says to yourself as well, you know, the words that have come out my mouth, how is someone with a brain injury supposed to deal with this? What if you did not have someone? How is this going to work? Because, you know, to this day, he's still not up to speed to deal with things like this. You know, you mentioned the driving thing, and unfortunately, Craig, you know, had to revoke his licence due to seizures. And it's myself that's been dealing with all that, because he couldn't deal with that. And that's something that still needs dealing with. So as much as pretty much the hospital and, you know, things like that are set aside now, there's still other things in our life that are going on that he's still not there yet. He's still not able to deal with that and go on and have that, you know, really important conversation with someone, or fill in quite a technical forum or something like that. That's all a bit much for him still. So to me, yeah, definitely. And that, you know, that's another side of it. It's a massive side as well.
And exhausting for the carers.
Yeah. I mean, we're currently trying to sort out the access to work for Craig, with him going back to work with his phased return, and that's proving a tad difficult, you know. So, you know, numerous phone calls, numerous emails, you know, and maybe, you know, some people as well are not quite up to speed with things like that, using laptops or emails and, you know, so it's an added pressure. It's an added pressure that's there, you know, for sure. So communication's got to work both ways, but, you know, it is an added pressure, I would say, for sure.
That's a really important point. Thank you so much for agreeing to do this, because I know that you don't enjoy technology terribly much, so it's amazing that you managed to join me today, and I'm so grateful.
I know.
No, I don't mean that, but yeah, it's amazing for me that you agreed to do it. I'm going to switch off the recording now.
Great stuff. So Craig and Kerry-Ann, Craig and Kerry-Ann unfortunately couldn't be here today to answer any questions, but I'm here if anybody has any questions to answer. But I think it's really important to hear what patients and their families have to say, and how we can improve services. Thank you.